Hello, everybody, and welcome to the Saaghe Fogwe podcast. I know it's been a minute, but I've been thinking about all of you, praying for you, wishing all of you well. I had a few things I had to put in place, but no excuse. We have to be consistent with whatever we do, right? Once you start something, once you promise people that you'll do something, you have to be a woman or a man of your word. And so we'll try to be consistent. If we skip weeks here and there, we might repost some of our previous shows, so that we can keep you engaged and remind you of topics that we've had in the past. Today, our topic is defining your lane. Defining your lane. That is as broad as it comes, but we will bring it home. We'll definitely bring it home because I have someone here she is exceptional. She's doing some wonderful things in the community. She is a people person, a fun lover. Oh yeah, she can have fun. But at the same time, she's a professional. So without further ado, I will want to welcome and bring to the stage Dr. Bikelle, MD. Welcome, girl.
Thank you, Saaghe. Thank you so much.
Good to have you. Good to have you. I know we talked about it. We talked about it some months back, but we weren't ready. We were not ready. And when we were ready, we were ready.
Yes, we were.
To get this done, right? So before we go into it, I sent you the link already. If you want to go ahead and share so people don't miss your introduction, we can share real quick, and then go on with it so they don't miss a minute of it. I sent you the link.
Okay. Let me see.
And I'll also share here real quick. Guys, if you're joining, get comfortable. It's a good topic today.
Let me see.
Yeah, we are live. Yep, it will be a good one today, guys. So don't miss out. Share, share, share. Yep. All right, a couple more shares and then we are good to go.
Give me a second. I'm getting there.
Yeah, it's a little slow too on this end. But you know, technology, when you want it to work,
That's when it doesn't want to work.
It can put you to shame, but we cannot live without technology. Yeah. All right. Let's see, a couple more. And we should be good here. All right, I'm good. Are you good?
Yes.
Yeah. All right. Let's get right into it. So, introduce yourself to the audience. Some people will know you on your platform, your social media handle, but tell people who you are, where you come from, your background, just things that if I meet you on the street, things that I want to know about you to get to know you.
Wait, thank you so much, Saaghe, for having me on here. It's a very nice opportunity to talk about things that are not talked about a lot in our community. Mental health is a topic that needs to be talked about more. So I'm very glad to be part of it today. So I'm called Bikelle, like you said. I'm born and raised in Cameroon, very proud African. I've been in the US since 2006.
What part of Cameroon?
Well, they call me the 11th province because my mother is from Bamenda Meta specifically, and my father is from the Central Province.
Okay.
So they call me 11th province, you could say that. So I'm a mother of 3 kids, and that has kind of led me to be a fan of American football, which I never knew before. But because my boys play in the team, I've become a soccer mom. So I'm a football mom. So I'm a busy mom and professional at the same time. So I'm an MD, specialized in the field of psychiatry, and it is a very dynamic and great field I have learned a lot about myself in working with other people. And it's really been the core of my career to be there for other people during the very, very vulnerable moments. I support other medical professionals that kind of align with the vision that I have. And my vision is mostly about impacting lives in a positive way, whether as a psychiatrist or as a person that genuinely cares for other people. That's what really, really resonates in me as a philosophy. So other professionals that align with that, I kind of support them in that light, so we can all impact the communities which we serve and bring that positivity that people need to live better lives. So that's just a little summary of what.
Of who you are. Yep. You can see the passion. The passion shows. It's coming
Yes,
out of your ears.
yes, it does.
So, talk to us about you've already kind of gone into your vision. What motivates you? What keeps you grounded and keeps you on task? Because you're even talking about you have 3 kids. I'm like, isn't she? Doesn't she look 15?
I know, I know.
She looks 15.
Yeah,
Three kids.
it is a struggle. It is a struggle. It's definitely a struggle to kind of balance, work and family life. And for me, I think over the years, I've kind of aligned myself with either my jobs or practice settings that help me put that work-life balance in place. So I have set up mantras for myself. So every day I'm very intentional what needs to happen for that day. So I come up with a word, a phrase, anything that I know can hold me down for that day. I do a lot of journaling, and it just kind of helps me with self reflection for interactions that happen between me and my colleagues, my patients, my family. And it just helps me, overcome some challenges that I face. Sometimes it helps me work on my own deficiencies, and it also helps me to see, celebrate my victories. So mantras have been helpful for me. Journaling has been helpful, and then just like I said, finding the right practice setting that really fits my family dynamics. That way, I don't have to be running around like a chicken with no head.
Yeah, I know, right? That's very important. And I've worked with psychiatrists before, and I had asked them this question. I'm like, so being a psychiatrist, don't you need your own psychiatrist or you need your own psychologist to, and it's important because you're taking care of other people's mental health, but who takes care of your mental health? And you've just given us a little insight of that, because it's very important as healthcare givers. It's very easy for us to forget about ourselves,
Yes,
take care of
true.
other people. So just speak to people who don't take good care of themselves. Just quickly, speak on that.
So in America, is a very busy country. We're all busy, trying to make ends meet. We're trying to pay bills. We're trying to juggle a lot of things, and the pressure is real. So in everybody's career, whether a medical professional, you work out of a gas station, you work anywhere, burnout is real. We work long hours. We don't have enough sleep. So a lot of people get to the point where that pressure builds, and then they start having, different signs and symptoms that the bodies are not handling what's happening. And if we don't pay attention, then consequences come along. It affects our relationships, it affects work, it affects so many other areas of our lives. So everybody really needs to, know themselves, know the limits, and when it's time to really, really find the right coping strategies to deal with different things that are happening. So it's not just about medical providers, it's everybody. So we don't want to wait for things to get big and bad when we can start putting things in place to prevent us to get to those places. So basic things like eating right, sleeping well, staying hydrated, eating the right food, keeping connection with friends and families, making time from work to recharge away from home, away from everybody, exercising, like all those different lifestyle changes that keeps your body balanced. We all need to be doing that because it's going to only catch up with you. And when it catches up with you, it's never a good scenario. You're either in the hospital, medical hospital, psychiatric hospital. So like so many other bad things can
Yeah.
happen. So I
Yeah.
think that everybody should make it a habit to take care of themselves and the people that are in the family, the environment. Yeah, very
Yeah.
important.
Very important. Yeah, and that kind of, it's a good segue into my next question, because our community, because you and I have a common community, right? It There's this stigma about mental health. There's a stigma where when you say, it's like we're not allowed to talk about mental health. You're not allowed to be depressed. You're not allowed to have anxiety. You're not allowed to, to show that you have anything going on up here. You have to be happy all the time. Or if you have any mental health issues, you want to put it in a bottle, put it under the bed and hide it. Or if you have children going through that, you're even ashamed to share that with people, because either they'll talk about you when you're walking by, they'll point at you, or you have people actually talk about what's going on in your situation, to the point where you don't want to confide in people, because of the toxicity around you. You don't want to share that. Please speak to our community so that we can break this myth or this stereotype, and kind of calm people down and say, you know what, it's okay.
Yeah, like you said, it's okay to not be okay. And I
Yes.
will speak from my own experience as like I'm a psychiatrist, but as a person, my brother passed away in 2017. I'm in Minnesota. It was a very devastating, situation for myself and my family. And at that time, there is no psychiatry there. You're a person, you have emotions. And I had to understand that feeling sad, feeling depressed, feeling like life is just really bad with losing a loved one is real.
Mhm.
So I had to separate between being a psychiatrist and being a person. And I hear you. Many people don't. They're very judgmental when you tell them, "Hey, I'm going through a hard time. I'm struggling." You're a psychiatrist. You can't tell someone that you're depressed. They look at like you've got it together. You're supposed to have it together. How
Mhm.
come you are telling me that you're not doing well? So, and that speaks to the stigma and the shame that comes with mental struggles that people deal with. So, the way that we can change some of this stigma is actually making mental well-being a natural conversation. Like we will talk about, what did you have at dinner? What was your day like? And just make it where we're very honest and open, so people see it as being strong instead of being
Mhm.
weak. Because when you don't address those issues that are coming up, it's going to show up in one way or another, whether you like it or not. And it's going to show up in a way that's bad, and it will even be worse. So I think that having those conversations at home is very important for
Mhm.
parents, checking themselves, talking about that among the adults, going down even to the children. Talking about emotional issues, struggles we have, challenges. What can we do for us not to get to a bad place? My
Mhm.
son went to Ireland for 2 weeks for the first time this summer. It was a big change for my family, and I could see my daughter that it was something that she couldn't adapt to. She was very isolated. She wasn't talking to us as much. It was a big emotional, like
Mhm.
it just felt very different. So we came up with, okay, they're gonna go to college. What's gonna happen? It's gonna be a big change for everybody, their father, myself, and the other siblings. What do
Mhm.
we need to do so we don't get into a depressive episode? It's okay to feel bad. It's okay to
Mhm.
feel bad about it, but how can you not get into a depressive episode? How can you build different ways of feeling like my brother's gone, but he's still, constancy in who people are? So we had to come up with different strategies to figure it out. So for us,
Mhm.
talking about being anxious, being stressed in school, feeling sad about things are very normal for us. I
Mhm.
think that's what families should be doing. I know that there's a lot of shame and stigma that comes to mental health, but at the end of the day, everybody have to ask themselves, if I don't talk about these things, if I don't process these emotions, if I don't handle those things, what becomes of me? It's not about other people. Because at the end of the day, whether you're doing well or not doing well, people are still going to talk about you. But
Mhm.
where do you want to be when people are talking about you? Do you want to be at a good place mentally? Do you want to be at a good place financially? Do you want to be at a good place physically? Or do you want to be at a place where you're pretending and covering these things that are going to come up and people are still going to talk about? So I
Mhm.
think the bottom line is, where do you want to be with the talk? Because the talk is not going to go anywhere.
Yeah.
Yeah, so I
Yeah.
think that's the bottom line. And we need to be talking about these things.
Yes.
We have to be open, we have to be honest, we have
Mhm.
to learn to embrace it as we're embracing physical health.
Yeah.
Because life it's not rosy. The
Mm-hmm.
challenge is every day.
Mm-hmm.
Yeah, so I
Yep.
think it'll be very helpful.
Yeah, we have to get better, and we have to have more of these conversations. So when we have our conventions, when we
Yeah.
have all these get-togethers, these are topics that need to come up. Instead of us just talking about, you know, things that really don't don't benefit our community that much. These are topics that we need to embrace. And one of the comments I got when I posted the flyer for this show was, "We have a Cameroonian psychiatrist." So speak to people who are thinking about going to psychiatry. What should they be looking for? And not everybody has to do it. Obviously, not everybody will be a psychiatrist, but what should they be looking for in themselves to see that, because you probably had some motivation, something that pushed you into that career path. So speak to people who are think young, say young Cameroonians who come here, young Africans who come here, and they're trying to define their lane. I know we're going to go into the NP, the NP part of this, but in terms of your career, like psychiatrist, speak to those young ones who who are thinking to be like you.
So psychiatry is a very interesting field. It's very dynamic. It can be very rewarding because you can definitely make a difference in somebody's life. And you see them the next day, it's like, oh my God, this is really, really good. But at the same time, it's also very challenging because you're spending time listening to people's problems every day. And if you're someone that you're internalizing some of these issues, it just wouldn't work for you. If you have a lot of your own issues that you're not able to process, you won't be able to support somebody else that's going through their own journey. So, for anybody that wants to go into the field of psychiatry, it starts with you. It is not just about finding a job or a career that pays well. It definitely pays well, but it comes with a lot of challenges that you have to be able to overcome for that compensation or whatever benefit that you're looking for is attached to. So you want to make sure you're someone that you definitely have compassion in the midst of distress, because the kind of patients that we serve sometimes they're not the nicest people.
Mm-hmm.
They're not appreciative of what we do. They'll curse you out. They'll threaten you. So if you're
Mm-hmm.
someone that you cannot separate your own personal issues from what it means to be of help to someone, then that field is not for you. So you want to start in that. That's the first place to start. Am I able to look at somebody's pain or whatever attitude they have? I'm looking at it like they have an attitude, but
Mm-hmm.
I'm looking at the pain behind it. Am I able to look at them and be compassionate and provide help? Number two is it's a very dynamic field. It's ever changing. And if you're someone that you don't have the mind to grow with, like learning new things and adapting, it will really not work for you. You want to be someone that can multitask. You're someone that you can deal with crisis, and at the same time you can deal with a very relaxed environment. You have to be able to move from one scenario to another, from
Mm-hmm.
0 to 100. So someone that's very resilient, someone that have their own personal issues together, and
Mm-hmm.
that means that you're working on your own self-care. Someone that has a very strong passion to support people in the vulnerable moments, and
Yeah.
someone that is willing to learn and adapt. And I think that if these qualities are there, you'll be able to succeed as any professional in the mental health field. That would
Yeah.
just be like the big picture of what I can
Yeah.
say.
No, that's good. Yeah, that really sums it up, properly right there. Even without being a psychiatrist, just working in a psych hospital as a medical nurse practitioner, I got cursed out
Oh,
multiple times. I had one guy was like, "You're from Africa. You need to go back to Africa. You came here and took all our jobs." And so, but I had to grow thick skin because I was one of those who took even not even psych patients, regular medical situations. I'll take it home with me because I always wondered, like in the hospital, like how did that story end? How did that person's situation end? Like even just taking it with me. Then imagine if So I know that I would have been one who would have struggled with with a field like that. But I've grown over the time. You get mature, you get seasoned, and you're able to handle it even better. So let's go into your mentorship program. So you mentor nurse practitioners, which is amazing, because I even have a lot who reach out to me. They're like, "Do you?" I'm like, "No, I don't." So yeah, so to know that you've dedicated yourself to really mentor nurse practitioners, and and help them define their lane. So speak to them, speak to nurse practitioners out there, potential ones, of course, your past students. Speak to them about what they should be thinking about if they're looking for mentorship. What does how did your program come about, first of all, and then what should people be looking for when they want to reach out to you to be their mentor?
Okay. So, as a psychiatrist, most of the time you end up in positions where you're supervising nurse practitioners. A lot of employers are, increasing access by, employing more physicians and nurse practitioners. There's a lot of shortage of physicians in America, and to meet with the need, we definitely need more providers to help. So I think that having this nurse practitioner program has been very amazing to increase access in so many communities and underserved areas. But the only thing is the training that they have is so short for them to be able to manage some of the complex patients that we have. Some of them have been very challenging for myself after being in practice for over 12 years. So I can imagine someone that has just the amount of time that in training with less hands-on experience that have to manage these cases. So when I'm working in whether it's hospital, I'm working in the clinic, I'm working in rehab centers, I'm always tagged with 2 or 3 nurse practitioners at a time. And we have a caseload to manage. And I get to realize like, oh my gosh, they're really struggling here. There's a big gap between their training and what real practice is. And for me to comfortably feel like we can collaborate on helping these patients, I have to get them to a certain sweet spot where they're confident and they have the skills that they need for us to all work together. So I will always take time out of my work schedule to say, hey, let's go over what are medications, comorbidities, just different things. Mm-hmm. And I felt like I could do other things and let them manage my patients without worrying about what happens. So that kind of brought me to the point where I felt like, well, these nurse practitioners definitely need the help. They need guidance, they need support. And most of the collaborating physicians that they have don't really set the time to do those. They need collaborating physicians to, exercise a scope of practice. But most of the times it's just an agreement. There is nothing else to it. They don't have time for consultation. They don't have time for real-time guidance. They have questions no one to answer. And it just feels like they're paying for the service, but they're not actually getting what the service really is. So I just took upon myself to say, I don't need to work with every nurse practitioner, but I will be very, very elated to see a whole wave of confident nurse practitioners out there that as we get older as psychiatrists, we are really proud to say we have some other people that are taking on, the torchlight to help everybody else in the community and over the world because we have confident practitioners out there. So that's how my mentorship program came about. So it's just me working with people that are willing to invest in growing in their skill set, in becoming more confident, getting more knowledge so they can help the patients, not just anyone that's just looking for someone to just talk to, like chit chat. It's like someone that's really willing to invest the time to grow. So I do have, I'm very available, I'm very supportive, I'm very knowledgeable, of course. And I think that I bring that great wealth of experience for over 10 years, working in all the practice settings you can think about that any nurse practitioner can leverage to be a better practitioner. So that's what my mentorship program kind of came about.
Yeah. So, are people? So, is it only local? Like the NPs have to be local where you are, or can they come from other states?
They can come from other states. I'm licensed in about 10 states, but for those states, it's mostly collaborating agreements, and like Texas, Ohio, Michigan, Florida, Georgia, South Carolina, Virginia. Minnesota is an independent state, but most of those states that are more restrictive, where you can't even exercise any scope of your practice without having a collaborative physician. So for those states, that's just a different kind of service. It's a little bit of mentorship and collaboration at the same time. We're working to help the patients together, but at the same time, I'm also teaching you different things that can help you to be a little bit more autonomous. Yeah.
Yeah.
And then
Yeah.
also I have, I try to create this little group of nurse practitioners that are, you know, kind of lean on each other, learn together, grow together in a private group that we can do different topics, little things. I post every day. We're talking about neurotransmitters coming up next week, and just a very simple way to learn neurotransmitters and how medications work. So when you're prescribing, you know exactly what you're prescribing to your patients. So private group, collaborative agreements, and I also do a live hourly talk every week on Wednesdays
Yeah. Okay.
from 6 p.m. to 7 p.m. And it's
I
just
need to
a variety
subscribe
of,
to that. Yeah.
you should, you should.
Yeah.
It's a variety of topics. I do case reviews. People bring the cases, I go over, give them different tips on what they could do differently. Then I talk about different topics, suicide, defining your lane, setting up a telehealth practice, just different things. And I do have a Q&A where you can ask questions and I can kind of guide. And it's free. You don't have to pay anything.
The keyword free. We
Yes,
like
yes.
free.
Yes, so
You know,
anybody can work with me
we
from
like
any,
the price zero.
yes. So anybody can work with me from anywhere virtually. I'm out of Florida and Atlanta, but I can work with anybody virtually.
Yeah. Yeah, I think we have a website too. We'll pull it up here. Yeah, we'll pull up the website so people just have a visual of it. But I'll also post it in the YouTube.
Okay.
No, we don't. Okay. Yes. Okay. We'll post it in the link in the comments, and when I do the video, yeah, I'll have it in there so people can actually, yeah, they can click on it and get with you to reach out. So how can other medical professionals collaborate with you? What people in our community who are in the medical field who might need your services, how can they collaborate with you? Just, yeah.
Well, I'm very open and very approachable, and I don't believe that every service that I provide or any interaction that I have with any other medical provider needs to be a paid service. So if there's anybody out there that feels like they need some kind of guidance on getting their foot on the ground, whether they want to start a practice, they want to see what direction they want to go with their career, or they just have different questions, I'm willing to support because it's all about giving back to in a way. So I am very, very open to that. Collaboration is one of the gold mine in the healthcare industry. It's very hard to be in this business that we're in and be solo. We can't make it. So what I nurses is social workers, is techs, is housekeeping. Everybody comes in with a different skill set that keeps the patient at the center. So I always believe that working with other people, whether it's medical professionals or anybody else, just makes care more. We bring out the outcome that we're looking for in patient care. So I am very into collaborating. I'm more into supporting other people to grow and be successful like me. I share knowledge for free. I don't mind. So anybody that's open to wanting to grow, they don't have to be a nurse practitioner. It could be a physician. It could be a physician assistant. It could be someone that's even thinking about going to school. What direction is good for you? Because at a certain age, you want to go a certain direction and not go another way because then you probably be losing a lot of time. And people want to talk about how to negotiate contracts, what to look in the pitfalls in contracts, pay, things like that. I don't mind to give some advice to help people so they can be there for their families too.
That's awesome.
Yeah.
And guys, did you see how she's not afraid to say she's successful? Did you see that? Because you know how we're raised to be modest and if I have too much money, it means I'm proud. Or no, it's okay to be successful. And I like how she just, not in a proud way, but she just slips it in there like, I'm very successful. So if you're out there trying to be modest, oh no, we need money because our community needs money. Charities out there need money. There are kids out there who need, other families who need us to provide all that, those services, provide financial support to them. And so nurse practitioners, psych nurse practitioners out there, you heard it here. She's available. She's willing to mentor, reach out. Don't be stingy. Support the project. Yeah, don't call and start beating the price to the ground. Please don't pay her money, because she's earned her time and she's earned her skills, and and it's her brain power that she's giving off to you. And the thing is, the reward, what you get from it, you might pay this little amount upfront, but then at the end, what you get out of the mentorship program is big. Because the biggest thing is to have to when you're on your own, because all these other states that we don't need supervision in, it's very nerve wracking, to be over your practice and you don't have anybody over you. But if you have a good program that prepares you, and you're confident, and you go out there, you feel empowered. You know that, like she said, we don't have that much, that we put into the nurse practitioner programs. But if you have a good mentorship after the fact, that really helps. I think that, that's a good, good support for us. So anything I didn't touch on that you wanted to talk about today, and maybe because I'm scattered brain today, I'm just coming back. I was at the lake all day yesterday, so I'm still kind of relaxed a little bit. So yeah, anything you wanted to talk about that I didn't touch on?
I think the last thing that I would really want to talk about is, like, the defining your lane, and it just means finding your fit. Anybody in any job, whether it's medical, whether it's IT, we always have to find the right fit for us. So that means that you want to look at your values, you want to look at your strengths, your professional goals, and your preferences. You want to make sure that anything that you're doing, wherever you find yourself, is aligning with those four things. Whether it's the work setting, is the kind of patients you work with, whether it's work-life balance, compensation, the kind of relationship you want to have with patients long-term or just for crisis intervention. You want to make sure that all of those align with who you are as a person. When you get out of training, you have all these different practice settings, substance abuse programs, inpatient, nursing homes, correctional, and you're not sure which one is always a good one to start. My advice to anybody is to start where you're able to experiment without feeling like someone's going to come after you. Community mental health clinics are always the best place to start. The patients may be severely ill, but there you can experiment with so many medications, and you have some kind of support from doctors to help you, so you can build a little bit of your expertise and your skills as you're growing. Another setting you want to think about is inpatient, because you're not pressured on timelines to see, like, the time duration of your service. And there's always an attending physician there. Those two settings are always good places to start. And remember, before you find the right practice setting that resonates with you, it's a journey. You're going to work at different places before you find the one that resonates with you. But don't try to be a hero. Don't come out of school and try to run a telehealth practice on your own. It's going to be a disaster at some point. Always start where you have a covering, where someone can back you up. And then when you feel comfortable, you can gradually get your feet wet on your own. So that's the one thing that I want to tell anybody that's starting out of training, whether you're a nurse practitioner, you're a physician assistant, you're a doctor. You always want to start where you have that covering, because I bet you malpractice is real in America. And
Yeah.
that's not what we want to be dealing with when we come out of training. So that's what I would really want to say as we close out today.
Yeah, very important. Yeah, because we get, like you said, we get greedy, we get hungry, we want to hit the ground running. If you don't, yeah, I always say, even, like in nursing, the most the person who comes in very confident, that's a dangerous medical provider, who
Yes.
comes in and you don't have that pit, that thing in your stomach that bothers you, like, oh, these people's lives are in my hands. If you don't have that, you're dangerous. If you're not, you have to be nervous a little bit. And that nerve, when it's nerve wracking, you want to make sure that you got yourself covered, and and making sure that we don't lose all the work we've put into. So that was very important. And that's why that topic was a good one to have today, to let people know that you need to define your lane. You need to have your niche, define your niche, and focus on it, and really make yourself specialized and good at what you do. So So we do want to appreciate you. I didn't want to do a very long show
Yes.
today to,
Yes.
you know how people zone out and they get glazed over.
Yes.
So we didn't want to do that. We will definitely have you back again. You know, we might do some segments with different topics
Mhm.
and pull in some NPs too, and maybe another psychiatrist, from another community or our community. It doesn't matter. We could do some kind of a panel conversation too to
Yeah.
get different views. But I really want to appreciate you. You're a busy woman to find time on a Sunday
Yes.
evening so we can have this conversation. It's amazing. So I do appreciate you. I appreciate all the viewers, all those who dialed in today, and those who will watch this and share it later. We
Yes.
appreciate you in advance. And go on her website. I think it's in the comments already, but I'll put it in the YouTube video as well, so people can click on it and get with her. It's right on the screen. Click on it, go to her website, look around. It's wonderful, and what she's doing is great. So until next time, I want to thank every single one of you and appreciate you. Yeah,
Thank you too.
stay blessed.
Thank
Thank you, Doc.